All right, hello everyone. Thank you so much for coming to our MedLaw Learning Series when it doesn't necessarily leave a mark. For those of you just joining for the first time, I'm Carly Oakson, a pediatric emergency medicine physician here in Atlanta, Georgia. And it's been so wonderful to have you all here, and it's been a privilege to provide this medical education, which can hopefully be applied to your legal cases as you continue all your great work to advocate and protect children and families. We have two of my remarkable colleagues here with us today who do so much in our community and great work surrounding gun violence awareness and prevention. I think this topic is definitely something that can touch all of us directly and indirectly. So I'm so excited to hear their talk today. I'll turn it over to Tracy to introduce them and take it away.
Beautiful. I have a great pleasure. Y'all are doing wonderful work. I'm going to introduce Dr. Sofia Chaudhary first. She is our assistant professor in pediatrics and emergency medicine at Emory University School of Medicine, and also a pediatric emergency medicine physician at Children's Healthcare of Atlanta. Her academic focus is on pediatric firearm injury prevention, specifically bedside interventions for firearm secure storage, suicide prevention, and violence intervention programming. She currently co-chairs the Violence Prevention Task Force for the Injury Prevention Research Center at Emory, chairs the Council on Injury, Violence, and Poison Prevention for the Georgia American Academy of Pediatrics chapter, and is the co-founder of the Georgia Clinicians for Gun Safety Advocacy Group. She is an Atlanta native and mother of 3 young children. And then we also have Kiesha Fraser, Dr. Kiesha Fraser. She is a pediatric emergency physician at Children's Healthcare of Atlanta and associate professor of pediatrics and emergency medicine at Emory University. She is a co-chair of American Academy of Pediatric Firearm Injury Prevention Special Interest Group and co-chair of Pediatric Emergency Care Research Network Injury Prevention Interest Group. She is also the previous past co-chair of Children's Injury Prevention Program. Dr. Fraser also has a DOH, is passionate about firearm injury prevention research, having published numerous articles in this area. In addition, she is a co-chair of the AAP's Firearm Injury and Harm Reduction Policy Statement. Dr. Fraser has worked with Children's Healthcare of Atlanta and Emory University for over 12 years. So wonderful experience and wonderful expertise in the room. So I will turn it over to you guys to share your presentation. Feel free to go ahead and try that out. And then if you guys have any questions or any issues with WebEx, I will be in the background if you need help. So let us know if there's any issues in the chat, and I'll be here to help you guys.
Does that look okay?
Beautiful.
Great. Okay, thank you all for having us here today. It's my pleasure for both myself and Dr. Fraser to speak to you all about this topic. This is really near and dear to our heart, and I think some of the ideas for this topic really came about based on what we continue to see in our communities, but also sort of at the bedside in the hospital. So we're going to talk a little bit about what surrounds us, the trauma of neighborhood gun violence. We hope to, over the next sort of 35 to 40 minutes, really talk about what are some general trends in gun violence exposure, just as a reminder, understand, what are the medical, psychological, and educational impacts on the affected communities. We'll highlight some of the data related to that, and then really kind of bring us uplift us all with sharing some effective evidence-based intervention strategies that have been shown to sort of really reduce some of the effects that we're going to be talking about early on in the presentation. And then we will highlight policies and laws that are related to prevention and advocacy. So let's first get into the data just a little bit. We're going to talk about data and gun violence exposure. So I want you to kind of think about how we can conceptualize the volume of firearm fatalities that we currently are seeing in our country. And if we look at the last 3 decades, we have seen the number of deaths that are equivalent to 12 Mercedes-Benz football stadiums full of people. And that is really for both youth and young adults through adulthood. If you really just focus only on the pediatric population, and for us in the peds world, the peds population actually extends through the early 20s because many pediatricians will care for kids while they're still away at college when they come back home. And if you think about that sort of that subgroup of youth, it's really equivalent to a little bit more than one football stadium full of people that have died over the last 3 decades. And I would say far too many, and something that we can definitely all contribute to doing something about. Many of you may have seen this graph. Some of the graphics that we're going to share are from the former office of the U.S. Surgeon General, and this report is no longer online. But thankfully, we all got to view it when it came out last year. And in this report, the Surgeon General's office really highlighted firearm violence as a public health crisis. What we have seen starting in 2019 to 2020, we saw sort of the crossing of lines where children and teens were no longer dying most commonly from motor vehicle crashes or car crash deaths, but really now from firearm injuries. Now, firearm injuries are now the leading cause of death for children and youth in our United States, and it has continued to stay that way, more than really any other injury mechanism, more than cancer, and more than infectious disease. From the same report, we learned from a national survey that more than half of U.S. adults have reported that they or their family member have experienced a firearm-related incident. You can kind of look over here to the right and sort of see what they mean by that. 1 in 5 have been threatened by a firearm themselves. Almost 20% have had a family member who was killed by a firearm, including suicide. Over 15% have been witnessed someone being shot. Almost 5% have shot a firearm in self-defense, or they themselves have been injured by a firearm. So it is really something that is sort of trickling through all parts of, our exposure. When we think about Americans and their experiences with gun-related violence and injury and deaths, we see that 1 in 5 have been personally threatened with a gun in the U.S. About 20% have had a family member killed by a gun. This is twice as common in Black Americans. 4% have been injured in a shooting. 1 in 5 Hispanic adults have witnessed someone being shot. And when we take a sort of a closer look at Black Americans, we see that they are disproportionately impacted compared to other racial and ethnic groups. So 3 out of 10 Black adults have witnessed someone being shot. Almost 60% have experienced one type of gun violence exposure, and they do have increased suicidal ideation. I will say that the most recent data has shown us that in 2022, Black teens ages 15 to 19 now have surpassed the white youth rate of suicide from firearms. So we are seeing more and more Black youth that are dying by suicide, specifically from firearms. Taking a closer look just specifically at our pediatric population, so children and their experience with gun violence exposure. This was a national survey that was done over a couple of different time points, and they found that 8% of all U.S. children have been exposed through a family or friend that has suffered a homicide. And although Black children only make up 14% of that sample, out of that 14%, 35% of those have had this experience. In comparison to white youth that make up more than half of the sample, their exposure rates are actually slightly lower. So again, just sort of highlighting the disparities and the disproportionate impacts on gun violence on our minority population. Looking at sort of, again, just another sort of interpretation of how children have been exposed to firearm violence. And this specific study is looking pre-pandemic and post. So pre-pandemic, 9 million children were exposed to greater than one fatality per a year. Pre-pandemic, also Black children had 4 times the rate of exposure in comparison to other youth. Hispanic over 2 times the rate of exposure. What was interesting was that during the pandemic, once it started, the exposure rates increased for every racial group. And it was greater, a little bit over 1.2.7 times greater for white children, an increase for every racial group, ethnic group except for Native Americans. What the study also found was that there was a lot of regional variation, with the South having the highest overall rates of exposure to violence, and then the Northeast Midwest having the greatest amount of disparities. So thinking about, what this means and what are some of the medical, psychological impacts of children and youth being exposed to gun violence, and really sort of the community around them. This headline kind of really captures sort of the reason for why we wanted to talk about this topic with you all. This is from a shooting and death, unfortunately, a tragic death that happened within the last week or so, where a young child was walking back from playing basketball with his friends in the neighborhood. This is a kid that's well loved by everyone. Just recently celebrated a birthday with the community and the neighborhood, and became a victim of a drive-by shooting. And the title for this article reads, and this is a quote from the neighbor, "Everybody's hurting." And they talk about, the story behind this uh, uh, young child that, is from Atlanta and suffered the unfortunate tragedy of sort of being caught in the crossfire. Um, and that kind of brings us to sort of how we have perceived what happens when a child or youth or even young adult, and their families are exposed to firearm violence. It really is a ripple effect. It affects sort of every member of community, starting with the individual, to their family, to their neighbors, to their loved ones, to the first responders, to those that are leaders in the community, whether it be, many of you in the judicial system, through the teachers. Really sort of everyone is touched by these tragic incidents. And we're going to talk a little bit more about the data around that. So looking specifically now at the individual, so when a child has suffered a non-fatal firearm injury, I looked at this data with some of my colleagues, and we published a report in Academic Emergency Medicine where we looked at kids between the ages of sort of birth to 18 years, before and after the firearm injury, so 1 year before and after. And we found that prior to the injury, a majority of these kids that were actually got included in the sample were previously healthy with really low healthcare utilization. After they got shot by a firearm and injured and survived, about half of them had qualifications now for a complex medical condition. And what that basically means is that they have suffered a physical injury where their body functions are not necessarily the same as what they were before. And it can be anything from relying on a tube to help them feed, relying on like technology to help them breathe. And so really it is so striking that these kids were previously healthy and as a result of this firearm injury now have sort of lifelong consequences related to their medical care. These families also have had a fourfold increase in healthcare cost for these previously healthy kids. This particular study also looked at sort of the impact of non-fatal injuries. We know that when children are shot, nearly 80% of them that are shot actually do survive. And when we compared the youth that were shot and survived to those that are sort of age matched, what they noticed was that there were significant increases in pain, psychiatric, and substance use disorders, about 144% increase in substance use disorders in the year following the injury. There was also significant increase in healthcare spending and cost sharing. There was a significant increase, and you can see the percentiles at the bottom of this graph, in hospitalizations, mental health visits, and really sort of other measures for healthcare utilization. This sort of came from that Surgeon General report, and I put this in here because I think it really highlights sort of the central story on the collective toll of firearm violence and exposure in the US. And so beyond the profound consequences of surviving a firearm injury, those who do not experience direct bodily harm with often grapple with mental health consequences related to the exposure, including community members, children, adolescents, and adults. In that same study that I just shared data on the child, that had survived the firearm injury, in terms of their family members, what the researchers found was that mothers of survivors had 30% increase in psychiatric disorders. These mothers also had a 75% increase in mental health visits, and really a decrease in sort of their routine office visits where they talk about general wellness and well-being. Fathers also had an increase, about a 31% increase in psychiatric disorders. And you can kind of see that displayed on the graph here on the right. When we look at those youth that have suffered a firearm injury and have not survived, so they've died from the injury, mothers of these decedents have had a 3.6 times increase in psychiatric disorders, a 15 time increase in mental health visits, over 100% increase in psychiatric medication prescriptions per month. We see similar impacts in fathers where they've had a 5.3 time increase in psychiatric disorders, like close to 90% increase in mental health disorders, and then over 125% increase in psychiatric medical prescriptions per month. Siblings of these youth that have died have also had more than a twofold increase in psychiatric disorders, and more than 130% increase in mental health disorders that have been diagnosed in the year following the death. Outside of, their direct family members that have witnessed violence, there is a lot of fear amongst our youth population based on what we're seeing related to mass shootings. And although mass shootings really make up a really small proportion, right, of the daily violence that we are seeing and the daily firearm injuries that we are seeing, we know that firearms are the leading cause of death for Georgia youth. And the majority of that is actually not mass shootings, but the impact of seeing these events, whether it be on TV or whether it be in your own school, are pretty dramatic. And so there was a national survey where they talked to adolescents and teens about concerns for mass shootings, and about half of this group of youth in the U.S. said that they worry about mass shootings or school shootings, and nearly 6 out of 10 of them reported that they recently thought about what would happen if a person with a gun entered their school or a school nearby. And I will tell you, being a mother of now a 6-year-old that's now in a local school here, I have also heard him say that we talked about where we would go to hide. And so this to me is, fairly scary, and also just sort of it's a hard pill to swallow to know that this is sort of the environment that our youth are facing. Additionally, in terms of other exposures to firearm violence in the school system, when students are actually exposed to school shootings, we know that they do experience a decline in health and well-being, that they engage in more risky behaviors and have worse education, and that really, unfortunately, the labor market outcomes for them is really poor. Additionally, those that have been exposed to a local shooting that have had fatalities in it, they have seen that 21% increase in these youth with antidepressant use in the following 2 years. I'm going to pass it off now to Dr. Fraser Doe. Kiesha, just let me know when you want me to change the slide, okay?
All right, will do. So we've talked a lot about some of the impacts on youth from their exposures and the impact on the parents. Now we're going to switch gears, talking a little bit more in this particular slide about community health workers. So community health workers in this situation, we're thinking about community violence interventionists. And for those who may not be familiar with this term, they are trained civilians that work to de-escalate and street and firearm violence. And this was a survey out of community violence workers in Chicago. And what they found was that a strikingly alarming level of secondary traumatic stress among the violence interventionists. Basically, the stress that they felt after dealing with or when dealing with clients who were either victims of repetitive violence or just dealing with the stress with the situation that was going on with the work that they're doing. And they found that 94% of them had at least one traumatic stress indicator. So the indicators are things like feeling emotionally numb, having trouble concentrating or sleeping, reliving some of the trauma that their clients were actually experiencing. And when they actually looked at this from a granular level, half of them had experienced about half of the different indicators on the actual scale of the secondary traumatic stress syndrome scale. And they were particularly, as you can imagine, their responses were particularly increased when there was a death of a client. This is not unlike what actually happens with healthcare workers when we are actually taking care of these same victims who we see the 12-year-old on our own child, for example, from the story and the headline that Dr. Chaudhary showed earlier. And this same type of secondary victim syndrome happens with healthcare workers also. You can go to the next slide. So this is this kind of a cascading effect, and some of the things that are cascading in this harm to across the society impacts all of us in so many different ways. So just for raw numbers, as we all often are aware, we probably heard, firearm violence and loss of lives has actually increased. So when you look from like 2019 to 2022, there was like literally 8,000 more people who died from firearm violence, and that impacts us from like just a society in general. And those who died, or those who were injured rather, were consistently much more likely to be our youth from the ages of like 15 to 24. We also, as we looked more granularly at the people and the impact, we look at the mothers who are actually witnessing of this. Mothers, as Dr. Chaudhary mentioned earlier, are actually more likely when they witness community violence to actually then meet the criteria for depression. Then when you think about those who actually lose a loved one and the impact on the children and the impact on the parents, all of these different things from the siblings who've lost a loved one to the parents to the fathers, all of them have increased mental health disorders diagnosed after being exposed to actually losing a loved one. Then we go from the cascading effect from like the individual to the injured to the witnesses to the loved ones. Then we're talking about the community, and we think about the teenagers who then worry about going to school because there was a shooting happening at the school near them, and their concerns. About 50% of U.S. teens have a concern about that. Then we think about kind of from the end of this cascade, or just like overall the U.S. and what that impact has on people in the U.S. And that 79% of U.S. adults actually report experiencing stress from the possibility of a mass shooting, while about a third actually say they're fearful and they make decisions about going to a public event due to the fear of actually having a mass shooting at that event. Please go on to the next slide. So now we're going to kind of go through a series of different studies that talk about the impact of gun violence exposure on mental health and healthcare utilization and education in children. So one of some of our colleagues in Philadelphia looked at children in a few neighborhoods in Philadelphia and in a very amount of zip codes. They looked basically at gun violence in their areas, and they looked at what their mental health outcomes were in ED utilization, so going to the emergency department after they experienced gun violence. And they found that children who experienced gun violence within 1/8 of a mile of their home, the odds of a mental health related visit was increased in the first 2 months after the gun violence exposure. They found similar findings if it was exposure within 1/4 of a mile from their home. And it was a greater odds and increased if there was more shootings close to their home. Next slide. So there are a lot of factors that seem to increase some of the depression and the mental health concerns that kids end up happening after having increased trauma and community violence. And so there was a survey specifically of youth between the ages of 13 to 21. And these were kids who lived in impoverished low-income areas in a northeastern city. And they asked them a few questions. They asked them, how many times have you seen someone else being threatened with serious harm. They asked them, how many times have you actually been beaten or mugged, which was kind of a question to help them determine direct victimization. And they found that the indicators for depression that were highest were correlation with direct victimization, so actually having experienced someone either threatening to mug them or attempting to mug them or being beaten up. It was also higher when they'd actually witnessed some community violence, so someone who had been harmed. It was also higher when they had peers who were making poor choices and were also getting into legal jeopardy, and also depending on how much their parents were involved in their lives, so how much supervision and encouragement they got from their parents. All of these things increased the risk of depression in these youth. Next slide. So a number of different studies that I'm going to talk about over the course of the next few minutes. We'll all look at this one data set called the Future of Families and Child Wellbeing Study. It's actually a very rich data set, and feel free to Google it and search it after this meeting. What the Future of Families, Child and Wellbeing Study has done is actually a longitudinal study that is representative of the United States based on 22 cities in the United States. And they have followed families from birth until currently is up to 22 years, birth of child, up to 22 years of the child is currently where their database is at. But in roughly around 2014, they looked at gun violence exposure by using a real-time surveillance database called the Gun Violence Archive. The Gun Violence Archive is a privately funded organization that you can literally Google right now and figure out gun violence in your community. And it looks at media reports, police reports, and things like that to determine firearm exposure. And so specifically what they did was look at these youth that were in the Future of Families, Child and Wellbeing longitudinal study that they've been following, about 5,000 youth over, like I said, 22 years, but this was specifically at roughly age 15 for the youth. And they looked at fatal homicide in their area. And they found that in this group of youth, about 53% of them experienced gun violence exposure within 1,600 meters of their home. And for those of you guys who do not think in meters, that is roughly about a mile. About 16% of them actually had gun violence exposure within 400 meters, which is about a quarter of a mile from their home. And what we looked at when I've actually looked at, so I specifically looked at this data set to try to see how that impacted healthcare utilization. And so what we found was that those who had at least one gun violence exposure, so one fatal homicide within 1 mile of their home, had increased odds of going to the doctor just for illness-related visits and increased routine dental visits. Not sure why they're going to the dentist more, but for whatever reason, students or focal children in this study were going to the dentist more and also going to health-related visits because what seems to be associated with their exposure to gun violence. Next slide. So we're going to switch gears for this one slide because I thought it was important for us to think about our neighborhoods. So if you can multitask, you do this now, but if you're not a multitasker, do this afterwards. I would encourage you to Google the Atlas of American Gun Violence. This is actually derived from the TRACE and the Gun Violence Archive, because I mentioned it earlier. And what the TRACE is a group of journalists that are dedicated to reporting on this country's gun violence. And they have worked together to actually help us as people in the US to actually ascertain if there's gun violence near our house. And you can put in your address, so Google Atlas American Gun Violence if you wanted to, and then put in your own address and you can figure out where shootings are near you, fatal and non-fatal. So I did this as I was preparing for this talk and found that there are about 5 shootings within 2 miles of my house. And this database, I think, is over the last maybe 10 to 15 years. So there was 5 shootings within 2 miles of my house. 3 of them were fatal, 2 were non-fatal. But there's actually not been any since 2017 compared to thinking about some of the exposures that we're talking about in our data with all these youth that we mentioned. And that the closest was actually over a mile from my home. So going back to some of the data that I mentioned where these youth were having exposures within a quarter of a mile to their home and to an eighth of a mile to their home, you'll see kind of what the disparities are, which I think are so interesting. There is also a study that actually I'll just mention, but don't have a slide to show you, where they actually looked specifically at this atlas and they looked at the city of New Orleans, and they showed that there was a significant income difference in the people who had exposure to gun violence in their neighborhood compared to it was more concentrated in more impoverished areas, and there was a lot more close proximate gun violence exposure in more impoverished areas in New Orleans compared to those that were more of higher to middle income neighborhoods. So next slide. So getting back to kind of the exposure, and now that we've talked about what proximity and how that kind of really impacts kids, they're once again using this Future of Families Child and Wellbeing Study database, which I said was a really rich database. You can find so much information out. Another set of colleagues looked at some data where they actually looked at specifically what this exposure did to measures of depression and anxiety. And in this survey, there's lots of information that they find. And what they found was that kids who had exposure to homicide within 3/4 of a mile from their home, about 0.8 tenths of a mile from their home, during 1 year prior to the study, found that they had increased associations with depression. So it was a greater percent increase in depression in boys specifically who had a gun homicide exposure. There did not appear to be any exposure increase for girls, an increase in anxiety or depression, but there was for boys. And overwhelmingly, they found that the risk was highest when they looked specifically at Black boys. There also was no association with anxiety in this data set. Next slide. So lots of different researchers have also looked at the impact, not just on mental health, but what's the impact on education, and what is the impact on school students and their test scores. So one researcher looked at students in a New York northeastern city. So this is actually in Syracuse, New York. And what they did was in Syracuse, the police have a database where they actually know where shots have been fired, and there's like the gunshot capture. And so what they did was they used the gunshot capture database where people would actually physically could hear gunshots. And then they looked at the neighborhoods that surrounded elementary schools, because as you know, in the US, elementary schools tend to be within neighborhood catchment areas. And then they looked at standardized test scores. And what they found was that those students who were in areas with a higher concentration of gunshots being heard had a 50% lower standardized test scores compared to students in other parts of the city. Another study or another researcher looked at this in a different way. So they looked at schools over a period of about roughly 10 years in Chicago. And they looked at known exposures to local homicide, and they looked at students' assessments, so standardized assessments also for children ages 5 to 17. And they looked at within 4 days of actually taking a standardized test, so thinking about when they actually took their standardized test, they found that there was a substantial reduction in in students' performance in reading and vocabulary on these standardized testing. It was much more notable in Black youth and not as notable in Hispanic youth. Another researcher also looked at similar kind of thought processes, and what they did was actually, this is in the city of Boston, and they looked within a week, and what they were wondering was more so kind of, comparing students from across all of the city of Boston and their standardized testing. And so they specifically looked at elementary students again. And what they found was that those students who had gun violence exposure within 1 week of taking their ELA, which is language arts test, had a reduced passing rate by at least 3%, specifically in elementary age Black students. Once again, multiple different studies showing that gun violence exposure also seems to impact school or elementary school achievement and school achievement in general. Next slide. So I also have another colleague of ours kind of looked at specifically the database, the Future of Families and Child Wellbeing. I told you like that database has a lot of rich information, and because it does the overlay with the gun violence archive, can really kind of give us some more information. So what this researcher kind of was wondering about was, how does this impact the aspirations and the thought processes of youth when they have gun violence exposures? So They previously, the same group of researchers had looked at the kind of like the depression and anxiety slide that I showed you a few minutes ago. Now they look specifically at kind of educational aspirations. And so they found that kids in this study, when they kind of looked at it at a granular level, instead of using the meters close to their home, they talked about within 6 or 7 minutes of home, which is still the same proximate distance of like 3/10 of a mile that I mentioned earlier. They also found, just kind of giving more information about the study database, that good percentage or average percentage of the students in this database were in families that were either 2 to 3 times above the poverty level or below the poverty level for a family of 4. So when they specifically looked at a few questions on the importance of high school graduation, they found that adolescents who were exposed to recent gun homicide had reduced high school aspirations. I mean, they didn't think they were going to do as well in high school because of their exposure to gun violence. But interestingly enough, when they looked at questions specifically about their increased college aspirations, they did feel like they were more likely to complete college and had more positive thought processes about college. One of the things that they hypothesize and could be feasible is that, oftentimes when people go to college, they leave the communities that they're in. And so they're assuming that when they get out of their communities that their likelihood of success would be higher. And so that's possibly why their college aspirations were much more positively influenced in their assessments compared to their high school aspirations, which were more proximate. Next slide. So, like I said, I looked at this database also specifically, not just for healthcare utilization, but I also looked at it for like school achievement. And so I looked at kind of what do the students kind of say, not what they said, but what they reported, and looking at what they reported compared to their gun violence exposure. So just to give you an overview of what their study population group was, about 22% of the overall study population, the students attended summer school, about 10% of them had to repeat a grade. When you look at those who actually had gun violence exposure, which was roughly 40 to 50% of the students actually had gun violence exposure out of this whole group, those who had gun violence exposure compared to those who did not had increased odds of attending summer school. Now, we do recognize that people attend summer school for lots of different reasons, but in this population, it did appear that there was an increased odds of attending summer school. When you compare that, or when you add that to adverse childhood experiences, there appeared to be increased odds of students actually failing a class when they had at least one adverse childhood experience, being suspended or expelled from school, or actually even attending summer school, in addition to having this gun violence exposure. So it shows how gun violence exposure does seem to inhibit or does seem to impact or be associated with some of the proximate achievement that adolescents actually have in high school, which overlays really nicely with the previous study, which talks about the students' actual aspirations, because they're already seen currently that they're having challenges in school, and it does appear that the proximate aspirations of what's going on is related to what's going on with their gun violence exposure at that time. So we have given a lot of different strategies, or a lot of different studies and evidence about what the trauma that surrounds us and the impact of neighborhood gun violence exposure on kids. And I will often tell people that I am someone who is more of an optimist as opposed to a pessimist. So I think of like the glass half full. There are things that we can do to prevent this. I don't want to end on a sour, dour note, even though this is something that I'm very passionate about. I also want to think positively about what can we do to prevent this in the future. So I'm going to talk about a few different prevention strategies that are already being utilized that have been shown to actually reduce the impacts of neighborhood gun violence and the trauma that actually surrounds us. So some of the things I'm going to talk about are actually some poverty reduction, and then community violence. I'm going to talk about hospital violence intervention programs and some of the legislative strategies. So the first slide, as you see here, is our prevention of poverty reduction efforts. So I am not at all going to tell you that I understand tax credits. I pay someone to do my taxes, as I'm sure many of you guys do. But what evidence has shown is that the earned income tax credit has really done a lot for low to moderate income families to kind of raise them out of poverty. When you look at poverty reduction efforts and you look at how this impacts communities that are at a higher disadvantage and are more likely to be exposed to gun violence, this has shown to actually reduce some of the negative effects that we have alluded to previously. And there's a lot of complexities around this, but as you can imagine, just a simple thing is that if you are able to get benefits financially from the earned income tax credit, maybe you can move out of this neighborhood and move into a school system where there's less gun violence exposure, for example. There have actually been studies that have actually shown that the monthly advance payments that were given during the 2021 tax season to parents actually at that specific time were able to kind of raise some families out of poverty and help them to relocate into different areas and to once again improve their financial income and kind of raise them out of poverty. So definitely that is one prevention effort and policy that has been shown to work. Next slide. So something that it seems is something that's very simple and actually is very economical, that has actually been shown to reduce neighborhood crimes and violence, is actually just having a vacant lot with grass. And so there's a picture, as you see on the side, of grass. And so what one researcher looked at was there was a randomized control trial in the city of Philadelphia where there was 541 lots that were either fixed, that were actually vacant lots that were actually fixed and put green grass on them and fixed them up. And then there were some that were not. And they followed this over 38 months. And then they did a survey of the participants, and then they actually looked at crime in the area. So from the survey, what they found was the participants that lived near the vacant lots that were actually treated, simply putting grass on the lots, making them beautified, make it basically a park of these areas. They found that their perception of crime in their area was reduced by 36%. There was less vandalism in their area, and they actually they had less concerns for safety. And the evidence actually shows, when actually look at the reports, they found that there was a 13% reduction in crime. There was a 29% reduction in actual gun violence. There was a 21% reduction in actual burglary in that area. So once again, shown that this was actually impactful by just simply putting grass. Simple effort, and actually super cost effective. Can you imagine the areas that you've seen vacant lots and we just put some green grass on it, and how much that can improve just the outlook that people actually have? So we talked about poverty reduction, we talked about greening. Now we're going to talk about something that is near and dear to my heart as a healthcare worker: hospital violence intervention programs. So what hospital violence intervention programs do is they actually take individuals who are now been victims of violent crime or violence in some way, and they actually provide wraparound services and supports after they have been admitted to the hospital, and kind of services from mental health services to social supports to job training to actual literally giving them cash to follow them over time and help them to reduce re-injury. So there are about two different programs that I'm going to give a little bit of data from, but there are multiple different programs across the country. So overall, and I believe this slide on the right side, this little is actually from the Surgeon General's report. But basically, what has been shown is that medical costs actually decrease. The average medical cost is about $37,000 per assault-related gun injury, but the average cost of a hospital violence intervention program is actually a third of that. So if we just provided care for someone who's actually been injured by gun violence, the cost that we are saving the healthcare system is actually very substantial. So in Baltimore, they've actually had a hospital violence intervention program, and that was studied for a number of years. And they found that participants in the program in Baltimore were 6 times less likely to be hospitalized within 2 years of actually completing the program. Another program that was actually in San Francisco found that their rate of return, so re-injury, was actually reduced. And once again, they also in the same program found that there was about $1 million that they actually saved annually just from from having a hospital violence intervention program. When the Affordable Care Act was actually implemented back in roughly, I believe, 2014, there was a group of researchers that actually looked at the cost on Medicaid. And what they found was that there was going to be more people who were actually going to join the Medicaid rolls when the ACA was actually expanded to cover more people. But if Medicaid actually covered hospital violence intervention programs, they found that Medicaid would actually, instead of costing Medicaid more, it would actually reduce the cost that Medicaid had overall by $69 million. So once again, just showing the hospital violence intervention programs are cost effective. Next slide. So what about community violence intervention programs? Some people have heard about hospital violence intervention programs, but they may not have necessarily heard about community violence intervention programs, and there's a number of them in the community. They are basically programs where the, violence interrupters, similar to the community violence interrupters that I talked about earlier on in my slide, work to actually reduce violence in the actual communities at the community level. So there is a number of different programs. There's Cure Violence, there's Safe Streets. I'm going to just talk about Safe Streets. So the Safe Streets program is a program in Baltimore where it's designed to reduce gun violence in neighborhoods with high levels of violence. And the frontline workers actually are recruited specifically to connect with individuals at the highest risk. And what has been found is that this Safe Streets program in Baltimore has actually been able to reduce homicides from 16 to 23% over 15 years. So that's one example of a program that is a community intervention program. Then another example is Focus Deterrence program. So Focus Deterrence program is actually a policing type program. And this program works with, it's a policing model, and they target high risk offenders. Law enforcement officers do some dedicated work, and along with social services to actually deter high risk offenders from future criminal activity. They offer them social services, and they also involve the community members who are most impacted. And this has actually been shown to reduce violent crime by 30%. There have also been programs that do like cognitive behavioral intervention, where they work with high-risk individuals to actually give them job training. But one thing that I think was really novel is actually in Milwaukee, they have developed this program where they have these violence reduction councils, and they almost do like kind of like a root cause analysis when violence actually happens in a community, and they're thinking about like what can we do to actually prevent this in the future, and they start making decisions and actually make and change an implementation and do actions that produce comprehensive steps and policies. They're able to actually reduce homicide in these communities by 52%. Just by these councils that are actually made up of community members in the communities that are experiencing the homicides. And finally, the last kind of bullet point that I have here is similar to the community greening efforts that I mentioned earlier. So the community green efforts, this is similar to that in that instead of not just fixing up vacant lots, the same researcher, Brannis, looked at actual areas where they actually fixed the vacant buildings. What has been shown is some of the vacant buildings are areas where crime would be more likely to occur, and where even firearms could be stored. And so just rehabbing vacant buildings actually reduce crime by 30%. All of these kind of very novel, unique strategies or prevention strategies have been shown to reduce community and neighborhood violence. Next slide. So I've talked a lot about some of the things that communities can do. And now I'm going to just talk a little bit in my last few slides about what impact legislation can actually have. So one of the things that is unique, and as we all know, as we are a member, here in the US, what is unique about our country is that we have 50 states. And in our 50 states, there are different laws. There are definitely federal laws, but there are also laws that are across different states. So some cities or some states actually have child access protection laws, which are the abbreviation that you see at the top here, which are CAP laws. And in the states that actually have cap laws, what we have been able to do is compare, what researchers have been able to do is actually compare states that actually have cap laws, which cap laws are laws that basically hold owners of firearms or who have children in their home responsible and requiring them to store their firearms safely. And in states that have cap laws, and a few states that I can tell you that do have cap laws would be Massachusetts and California, but also places like North Carolina and Texas and Florida have some variation on cap laws. These states that actually have cap laws actually have been shown to have reduced firearm homicide rates, unlike the state of Georgia, for example, that does not actually have a child access protection law. The reason why these laws are helpful is that they actually reduce access to firearms to those people who should not have access to them, who are unauthorized users, who may be youth, who may be getting access to firearms and making impulsive choices. And then once again, would be a way to reduce neighborhood firearm violence. These laws that actually strengthen background checks have also been shown to reduce higher homicide rates. And one of the things that cap laws actually do too is they decrease youth actually just carrying firearms in general. So overall, one policy that would definitely be impactful would be child access prevention laws. Now, my next slide, which is actually my final slide that we're going to talk about in our prevention strategies, next slide, is an overall slide that really covers, and this is something that we will look at a little bit, but you can go back and look at this by the RAND Corporation. And they just looked at overall all the different policies in different states across the United States. Once again, the benefit or disadvantage is one way of thinking about it. But as for a research standpoint, it's benefit of being able to look at states that have these laws and states that don't have these laws, but also looking at when these laws have been implemented across the United States, because some of the laws are nationwide, such as requirements for background checks. When these laws are implemented, what their impact is on violent crime. So some of the laws that are most impactful is waiting periods. As you can imagine, if there is a waiting period for a person to purchase a firearm, that gives them a few more moments before they're actually going to make a decision to commit a crime. As I mentioned, child access protection laws have been shown to reduce unintentional firearm injuries and death. Minimum age requirements has actually been shown to reduce suicide, which, as Dr. Chaudhary mentioned, how that is increasing in the youth, especially in Black youth. So it gives them a little bit of a time for them to think before they actually are getting access to a firearm. Extreme risk protection orders, which are actually orders that require people to, basically take away firearm access to people who are at risk for mental health concerns. Those are all things, legislative policies that have been shown to reduce firearm injury, firearm death, and just reduce the impact of neighborhoods. Licensing and permit requirements have actually been shown to actually reduce mass shootings. So as I kind of think about all of the different things that we have discussed over the last 30 to 45 minutes, there are lots of impacts of the trauma that surrounds all of us, but there are also lots of things that we as our community can do, from not just legislatively to actual things that we can do in our communities from a local level, from a hospital and healthcare based level versus a community level. One of the things that I really liked about some of the studies that I presented earlier were things that communities that were doing themselves by thinking about fixing up the vacant lots or rehabbing buildings, or as I mentioned earlier, the communities that were doing the community councils to actually look at root cause analysis and actually try to reduce crime in their area. So there are different levels of intervention that we can actually, that can be implemented in areas that have higher incidences of crime, but that those of us who are involved in trying to prevent and help with the trauma around us to actually reduce crime could work on. And that is basically the end of our talk for today. I'm sure there will be some questions, and if there are, we'll be happy to answer them. Thank you for taking the time to listen to our talk today.
Thank you so much. That was such an incredible talk. It's just so good to kind of put it in that context of not just the incident, but all the downstream effects on all the layers within the family and community, and then what we can do to help this group and our future generations and everything moving forward. So thank you so, so, so much for that. We can look over into our comments and chat. Tracy.
If you guys are a slow typer, like I am myself, please don't have any anxiety, type away. But I did also want to add that June is firearm prevention or firearm injury prevention month. I know we only have a couple of days left, but it is still time to show our advocacy. June 21st is always just Ask Day, or Ask Day. So you can also kind of on an individual level start implementing this change and mirroring it for the people in your lives and in your community, of just asking when you drop your kids off to someone else's home, or if someone's going over for a play date, you just can simply ask, do you have an unlocked or loaded firearm in the home? And asking these questions and mirroring what that looks like for the community. So that's also there on an individual level. So I can pop some info in the chat from our Strong for Life team at Children's Healthcare of Atlanta, which I know, Dr. Fraser, you have done a podcast as well for Children's on the Hope and Will podcast. So that is there too, if anybody wants to go take a peek at it. Those links did not come through, but I'll add it into the chat here shortly. But I appreciate you guys coming on and talking about it and making sure that this is available, especially in the month of June. It's an important month.
Yes, absolutely. They have been champions for our assay programs within Children's, which is very effective.
For some reason, those links don't go through in the chat. I think it's because we have it set up differently than what I'm used to. But Angie, you'll get an email, a follow-up email coming from Dr. Angie Boy, our program manager for prevention and training, with different details in there. So I'll ask her to add some of those resources, or you can just go to strongforlife.com and it has different safe firearm storage tips and tricks and stories from an individual, a Georgia mom that has been affected, and her family has been affected from, a firearm incident. And then also you can find the Hope and Will podcast with Dr. Fraser on there. I've heard great things about it. I always get backed up and don't get to listen to all of them. But that will be my next stop because I've heard great things. But I will make sure those links are in there in that follow-up email.
Here, if there's, because I have my screen shared, I don't know if there's any comments, but in the meantime, we have our last session next week, or I'm sorry, on Friday, on abusive head trauma with Dr. Stephen Mesner. And so that should be a great session as well. And then for everyone for CLE, after all of the sessions are complete, then I'm going to compile the list and submit that, and then you can claim your credit with the Georgia Bar. So we'll get that situated. And then you can also take our post-course survey.
And then I'll put that post-course survey into the chat for folks that are on their phone and can't scan the QR.
Perfect, thank you. I think that there was just 2 comments that we'll say. So one person had said chilling, especially when you were showing, when you put in your zip code and to see where the shootings are, that is a very impactful thing to see. And then someone else said, I truly believe that we can do more for child welfare by eliminating family poverty than continuing to fund foster care. And that's a lot of good, very important, like preventative thing. I don't know if you all wanted to add on anything. Cool. If there's no more questions or comments, of course, you can always email us with anything and we can send them to Dr. Chaudhary and Dr. Fraser Doe to answer any comments that you have. And thank you again so much for coming and giving such a great talk, and to everyone else also for coming to participate. Okay.
Carly, do you mind? I can't seem to come through my stuff and find the post-course survey. I know Angie organizes those for you, but do you mind popping that in the chat for folks?
I'll put that right here.
Thank you. And I echo all that. Thank you guys so much for coming on and chatting. I'd love to have you on for our child protection webinar series. It's annual. We do several sessions throughout the year. And I'd love to have you guys next year for June for Firearm Awareness Month and Injury Month. If you guys would like to, we'll email about it. We'll chat about it. But I think our audience would love to hear from you.
Thank you so much for having us.
Thank you guys. Thank you, Carly, for
Guys.
popping in the chat.
Have a great day, everyone.
Bye.
Bye, y'all.
Bye.